Hello, my name is Joshua Mugabi. I welcome you to topic 10.3, Sexual Reproduction in Humans, Learning Outcome Age, Recognize the health risks, stroke complications associated with early teenage pregnancy and abortion. We are looking at learning activity. Learners visit a health facility, listen to a visiting profession, and in groups carry out research on dangers associated with early stroke teenage pregnancy and abortion. Individuals produce reports, stroke posters explaining the above 2 points. Teenage pregnancy and abortion, item 1. Want to look at the causes. Learners receive a guest talk from a health professional and listen to explanations on teenage pregnancy and abortion. The aim is for learners to understand social, physical, and psychological risks of early pregnancy and abortion. Tasks. What are the causes of teenage pregnancy? What are the causes of teenage pregnancy?
Her dream is to become a doctor to treat people and help pregnant mothers to successfully give birth. But that dream was threatened after getting pregnant. Jerry, 22, non-real name, senior 3 student at a local school, was responsible for her pregnancy. He left the village when he learned that Lucy was pregnant and has not been seen since. Lucy's parents reported the case to police, but they could not find him.
I know if I don't go back to school, my dreams of becoming a doctor will not be realized. I am determined to go back to school after giving birth.
Hello everyone, I am Dr. Supriya Arwari, gynecologist. I am going to talk to you about common problems faced by teenage girls. In this video, I am going to talk to you about teenage pregnancies. Teenage pregnancy is a very dangerous thing to have. Getting pregnant in your teens is not at all healthy, not for the mother, not for the baby, and not for society at large. Being sexually active in teenage is not advisable. However, if it does happen and you find yourself in a bad situation, you should know what impact it can have on you as well as the baby. In conclusion, it is always best to prevent teenage pregnancies, and the best way to prevent teenage pregnancies is to avoid sex during teenage. However, With proper sex education, you can at least avoid a pregnancy which is unwanted, especially with knowledge about birth control, like pills, like condoms, like IUDs. You can prevent a pregnancy. If at all a pregnancy happens, please seek immediate help from your doctor. Don't consult quacks or don't indulge in illegal abortions because they can be very dangerous to your health. Seek help from your doctor. Thank you.
Let's go back to our question. What are the causes of teenage pregnancy? What are the causes of teenage pregnancy? We have several of them. There is peer pressure. Pressure from friends, what your friends are telling you. Then there is lack of sex education. This can also cause teenage pregnancy when the teenagers are not educated about sex education. Then we have early marriages. Most of the teenagers, especially in rural areas, they end up being married at an early age. So they will end up becoming pregnant and they're at their teenage stage. Cultures. Some of our cultures believe that girls are for marriage. So that one also is going to cause teenage pregnancy. Then we have poverty. Due to lack of requirement, basic needs, this one is going to indulge girls, young girls, teenagers, into sex, which may end up resulting into teenage pregnancy. The environment where the child grows from is also going to expose the child to teenage pregnancy. For example, girls that are exposed to bars, clubbing, and all those other social events that take place late in the night, those ones are exposing the girls to teenage pregnancy. Then we have poor parenting, whereby we have parents who are not bothered about, who do not care about their children, their well-being, where they are, what they are doing. That one is also resulting in teenage pregnancies. Then we have sexual abuse, and this abuse can be done by people, friends, neighbors, village mates, town mates, even relatives can end up abusing these teenage girls, and they end up having pregnancies at their early age. There are very many, but just to mention a few. What are the dangers associated with the teenage pregnancies? What are the dangers associated with teenage pregnancies? 1. The physical danger. Let's start looking at the physical dangers. There is a higher risk of complications during pregnancy and childbirth. For example, obstructed labor, preeclampsia, anemia. All these are physical dangers that are associated with the teenage pregnancies, having complications during pregnancy and during childbirth, because the girl is not yet well developed, her body is not yet mature. Obstructed labor, preeclampsia, and anemia are likely to occur. Those are physical dangers. Still under physical dangers, we have a higher maternal and infant mortality risk. Because the girl is still a teenager, there is a high maternal and infant mortality risk. The body is not yet well developed. The bones are still young and weak. They are not mature. So during birth, there is high chances of maternal and infant mortality risks. There is increased chance of low birth weight or premature baby. Because this is a child, having a child, a teenager, becoming pregnant, the teenager may not get the well-required nutrients to feed her in the pregnancy stage. And this one is going to affect the weight of the baby, that the baby may end up having low weight, or the baby may end up being produced when they are premature. So those are all physical dangers associated with teenage pregnancy. Now we have the social and educational dangers. 1. There is school dropouts or interrupted education. Some of the teenagers, when they become pregnant, it is a higher chance that they are going to drop out of school. And if they are a little bit lucky, their education is going to be interrupted during that period of giving birth, that period of early childhood, taking care of the baby. Their education will be interrupted, but they can go back to school. But there is interruption in education, and most of them are likely to drop out of school. There is likely to be a remarriage and reduced career opportunities. These younger girls, they are likely to enter into marriages, and this is a social danger that teenage pregnancy brings. Because they have become pregnant, their parents become disappointed and they give them up. And this one is going to push the teenager into a marriage. Now, this one also, teenage pregnancy, reduces the career opportunity, because the teenage girl has dropped out of school because of teenage pregnancy. Majority of them, they don't get an opportunity to go back to school, meaning that they have lost their chances of having better career opportunity. So that is an education danger brought about by teenage pregnancy. Still under the social and education danger, there is stigma or rejection by the family and the community. That stigmatization, where a child becomes pregnant, there is rejection, there is that stigma from the family and also the community. They reject the teenager. The family reject the teenager because the teenager has not well behaved, or the teenager has not shown respect to the family. Even the community will stigmatize this teenager. The teenager will be rejected by friends, by the community, and that one becomes a social problem to the teenager who has become pregnant. Then we have the psychological danger. This teenager becomes emotionally stressed, depressed, and having a lot of anxiety. There is a lot of stress, emotional stress. Being a teenager, becoming pregnant, and in most cases, the responsible people, they always take off. And the responsibility goes back to the parent of the teenager. This brings about emotional stress, brings about depression, and brings anxiety in the teenager. Then there is also pressure from partners, peers, and society. Because being a child, becoming pregnant, there is going to be a lot of pressure from the patterns, where they will be encouraged to carry out abortion, where there is going to be denial of the pregnancies, where the peers are rejecting the teenager, where the society is talking and gossiping about the teenager. All these are psychological dangers which are brought about by teenage pregnancy. Now let us look at abortion. We want to look at dangers associated with abortion. And our question is, what are the dangers associated with abortion? What are the dangers associated with abortion? Want to look at the dangers associated with abortion. Let's first of all look at the physical health risk. Abortion may lead to excessive bleeding and anemia. That is a physical health risk associated with abortion. It results in excessive bleeding, and loss of blood results in anemia. There is likely to be infection and infertility due to unsafe procedures. These procedures that are carried out during abortion, they may result in infection of the uterus or the utellus or the reproductive system. And this may result into infertility, whereby this person will never produce again due to unsafe procedures. So all these are physical health risks associated or dangers associated with abortion. Then we have the danger to reproductive organs. So when abortion is carried out, it is very dangerous to the reproductive organs, the uterus, the ovary, fallopian tube, the whole reproductive system may be damaged due to abortion. And there is also a risk of death, especially from unsafe abortions. Abortion may lead to the death of the person carrying out abortion. It is risky, it is dangerous, it can take the life of the person carrying out abortion. Then we have the psychological effects. Psychological effects like guilt, shame, depression, or anxiety. So when a person carries out abortion, the person will always be feeling guilty. Person will always be feel ashamed. Person will become depressed. A person will always be anxious. There is post-traumatic stress in some cases. The person becomes traumatized after the abortion experience, the process the person has gone through, the pressure, the anxiety, all this bring about post-traumatic stress. We have the social risks. There is stigma from the family and the community. When the family knows and the community gets to know that this person carried out abortion, there is going to be stigma from both the family and also from the community. Then there is also a relationship problem. People will try to distance themselves from the person who has carried out abortion. Peers, family members, and even the community members. Let's look at the key message. Teenage pregnancy and unsafe abortion are dangerous. Proper health education, antenatal care, and family support can reduce risks. Skills demonstrated. There is the observation and listening skill during the visit to the health center facility. There is a research skill where you consulted multiple sources. We have the critical thinking and discussion. These were group brainstorming. There is communication skills, whereby you create a report or posters. And lastly, application of knowledge. And this is relating biology to real life situation. Thank you very much for participating in topic 10.3, sexual reproduction in humans. We have been looking at learning outcome H. Recognize the health risks, stroke complications associated with the early or teenage pregnancies and abortion. Our learning activity, the learners visit a health center or facility, listen to a visiting professional, or in groups carry out research on the dangers associated with the early stroke teenage pregnancies and abortion. Individuals produce reports, posters explaining the above 2 points. Please visit me at Mugabi Joshua Biology on YouTube. Don't forget to like, to share, and subscribe.